good. And he had one of those lines. So one day, Dwayne showed up when I was in Burbank, California, and he was like this. And he didn't know why he was like this, and I didn't know why he was like that. But his arm was in a spasm like this. And so Dr. Anderson, I put Dr. Anderson on this one point, heart points, because the heart points were standing out very firmly in the eye. And all of a sudden, her eyes got like this, and her lines were forming in her heart area as she could not stand the electricity that was coming out of Dwayne. And so I jerked her hands off of that, and I plugged my finger in there, and I got the same jolting that she did. And I was either too numb to really be alarmed over it, but I could feel it very firmly and just jolting my body like this. Now, after a while, Dwayne remembered being up in the rafters there, putting that blower in, and he remembered getting electrically jolted by that, but he didn't remember falling down on his back and getting knocked out, where he was knocked out for a couple of days by hitting his head on the cement. But all of that came out of him, and his arm was fine. Took me a couple of days to recover from it, but Dr. Anderson had a big red line in her heart area as a result of that. And she had to have her points held. Now, it was really a very confusing day, because we had people there at our seminars with magnets and everything else, and we had people lined up, people holding people, and one guy from Caesar's Palace, he was a massage therapist, came over and grabbed hold of Dr. Anderson, and he got jolted, knocked him completely out. And he remembered when he was in the Russian army, where he was thrown down into a great big pit with a bunch of rats, and he went through that experience with all the memory coming back. He was screaming and yelling about the rats biting him and so on. And this is his punishment for disobeying. They threw him down in a pit, and a bunch of rats were down there. Every time he fell asleep, he got nibbled on. And so he went through all that terror. And other people went through their terror. And people were balancing up Dr. Anderson with all these big magnets and so on. Maybe they worked and maybe they didn't. But I was sitting here holding Dwayne and getting the life out of me jolted, And so I let them do what they want to do, or let me handle Dwayne, And that's where I was. But it's just a very strange day. But in the meantime, this particular thing disappeared from Dwayne, but Dr. Anderson then had a big line in her heart area where she got just jolted terribly by working on Dwayne. So there are going to be possible, shall we say, occupational hazards when you come to body electronics. And those are the chances I've had to take, and those are the chances you have to take, but you can be fixed, okay? I have, honestly, this is the truth, there have been times I've held a point, and it felt like I got jolted with a full 220 just by holding a person's point. Has that happened to anybody in here? Just a jolt. You understand? Okay.
You may have partially answered my question, John. With the line, does it occur instantaneously with the electric shock, or will it come later when you're ready to release that particular episode?
It could come later because it takes the body a little while to readjust to it.
Right. So it may not necessarily be there.
It would probably be the next day.
Oh, okay. All right. Thanks.
So it's on its way.
Right.
Okay. Kyle.
It's a thing that's just triggered a memory I wanted to ask about. The difference between doing body electronics when the body is electrically grounded to the earth or not, and whether that shock would have been discharged into the earth rather than into the tissue structures and minerals in the person's body if that person was earthed. Have you ever thought about that?
I've thought about it. I haven't done anything about it. I mean, should we tie a few trees, take a copper wire and tie it to a few trees or a few steel pipes in the ground?
I'll have a go.
Let's give it a go and see what happens. I don't know anything about it because I've never done any research on that. If it kills the tree, it's your fault.
I'll skip the tree then and use a stake.
Have you ever seen what lightning does to a tree?
Yep.
Okay, and we've all seen what happened to people here who have been hit by lightning. I think, remember a guy and a lady by the name of Rose from up at Noosa Head? And Guy had those brown eyes. His eyes turned green. I think we have that on tape somewhere here. And his all of his fingers, between his fingers, were all blistered from the lightning that came out of Rose as he was holding Rose's points.
Now, when he got up later on and held, everyone else was suffering holding points on this lady, and he finished and came over and held someone else, and he looked at them all and said, "Hey, this is easy compared to what I just went through."
Yes. I heard really good news. What he's always wanted to do, he's out on a boat out of Cairns going out to the Barrier Reef now, enjoying scuba diving and all that sort of thing, and he's just as happy as could be. He gave up naturopathy. I mean, he felt he should help people, and that's what we ought to do. I've really got to be a rescuer, you know, and help people's health. And he had his points held and went through body electronics and got zapped a few times and got well, perhaps. And now he just literally is now doing exactly what he wants to do in life. More power to him. Thank you, Kyle, for your question or comment. I'm running out of time here, and I promised we'd have a short break. So take a short break here at this point of time, and then we return in about 10 or 15 minutes. Are you having fun yet? What he wants to do in life. Now, I think we all have an understanding on the left eye. In your notes, please. In the left eye, at 3 o'clock you have your indicator. Where will your indicator be in the right eye? At 9 o'clock. You got that? Okay, that's for the heart and all of the other associated organs that would be overlaid with the heart area in that particular area. Now, I would like you to look at this next part, Anita. If you could pull this over and get this part in here. Okay, there you are. Here you have a what? What's this called? An indicating line. And what's this called? A degeneration line. So you have an indicating line crossed over by a degeneration line. This is like a pair of crossed water pipes in your house. Or it's like a couple of streams under the house that cross. Here is where you have an area. Now watch me carefully. You just take your little pointer in your mind and go right directly into the center of the pupil. And this little X right here should be pretty close to the third zone of the iris of the eye. It should be within that category, and you probably will find something in the endocrine system right here which will be blocked off, but it'll be in zone 3 area. It may be in zone 2, which would be the colon area because of the close proximity of one to the other, okay? But you take a good close look at that. Now, normally you'll find areas where there'll be a little tumor, or there'll be possibly a inside here you'll have a dent in toward the pupil of the autonomic nerve wreath. You may have fibers that are like an asparagus effect. You can have a number of different things that you'll have to look at to find out what is causing the breakdown of the tissue in that particular area. But you have to take this particular cross right here and move it in here and find out where the problem is in zone 3. Maybe it's out to zone 4. Maybe it's down into zone 2. You understand what I'm saying? Are there any questions? This is not the time to remain quiet if you have a question. Good. Now, the next thing I'd like you to go to then is number 2 on the Sclera checklist for sclerology. Let's go through that carefully. Now, on number 2, you make note of all degeneration lines. And these can be rather complex and confusing at times because sometimes they may be kind of like a diagonal in the eye. But first of all, you check for close proximity or the distance from the iris, which was Michael's original question when he asked about if the degeneration line is very close to the iris, it's usually in the digestive system, possibly the stomach ring area. Okay? Now, so is it far away from the iris? If the further it is from the iris, the further out you have, depending upon the zone numbers in the iris itself. Do you have that? Everybody clear on that? Okay. B, check for all crossing over of the indicating lines and degeneration lines and determine the proximity to the iris. I think that's clear. Okay, C, make note of all double degeneration lines. Now, when you find a double degeneration line in the sclera, you know that you have a problem in the area that traverses or covers. So if you find a double degeneration line in the iris, you know you really have a problem in that area. Now, D, let's make sure we understand the terminology here. On D, on page 2, top of page, it says make note of all tie-ins where a degeneration line passes over an indicating line and does the same for one or more other indicating lines. So a degeneration line will tie together into a very reactive mode like A equals A type of thing. It'll tie in one indicating line to another indicating line where both of them have to be dealt with then as two separate but combined entities. E, make a note of degeneration lines in spinal areas and cross-reference with the iris. So you always cross-reference the degeneration line with the iris. Now, Anita, could I have the next overlay, please? So there's no confusion here. We're dealing with the distance of the degeneration line from the iris. If this is close like this, which you'll see right in here, which you'll see in areas where you know you have digestive disturbances in zone 1 and 2. You'll see it close in here. Oftentimes you see it further out, like right in here, which could be out in the back area, okay? The one that we'd have up in there would be further on out in zone, maybe zone 5 and 6. So you take a look at your various degeneration lines and make a notation of their closeness or close proximity to the iris itself, and this will help you determine what some of the problems will be in the iris. Okay, next please. Which eye? Left eye. Look at the Jensen chart. This is the spine. I'm going to show you what we're dealing with. The spine is roughly between 7:15-ish to about 8:15-ish, okay, in what we call the left iris. In the right iris, it's opposite, okay? Do I need to go over that with you? Okay, so you not only look at the spine, you take a look at what's happening out in here, and that's very, very interesting. Back to the overlay. Okay, here's the spine. Whenever we have this particular marking in the iris of the eye, about this distance away from the limbus or the edge of the iris, you will find that this will indicate that the muscles in the spine area will be very, very tense. Now, you might ask, well, why are they tense? Is it due to the blood supply or the lack of the blood supply to the muscles there, which would cause them to have a lack of oxygen, therefore they're in pain and you have a tension in the area? And the tension, of course, will be removed with the good massage work and so on. But even though you will remove the tension with massage work, this particular series of this red line will still be there. Okay? The red line will still be there. So you will notice on your body electronics flow sheet on the second page where it says curvature of the spine. It's about 6 or 7 down on the body electronics flow sheet. And you will mark the left side like a big L with a circle around that, showing that the left side of the spine will be affected. Now, Ian, can I have you up here, sir? You're moving. Turn around with your back. Now, if I see in his left eye, which is to your right as you're looking at it, this particular sign, that means the muscles on the left side of the back, for whatever reason, will be tense. Now, when those muscles are tense, and I've looked at tens of thousands of eyes, maybe 100,000 eyeballs, and what I found in every single case is that the tension of these muscles through here will have a tendency to pull the spine off over to the left to where we will have a spinal scoliosis. Now let's say that we have, you can sit down for a minute. Let's say that we have we have this particular figure in a right eye. You'll have it over here. And so you say you have one on the left and you have one on the right. Now, if that happens, then the muscles on both sides of the spine will be very, very tight. And therefore, because both are tight, it'll cause you to kind of hunch over into a kyphosis. And your back will be all hunched over like this. And you will then be working on correcting the curvature of the spine on both the left and the right, which will be, you'll mark on the body electronics flow sheet. And that's, if you remember, if the back curves to the left, you work down in the right gluteus maximus. If see, which way am I looking at, right or left? I forget which is right and which is left. I said left. If the back curves to the right, is pulled off to the right, as you're looking at me, this is my right side in the back, then I would work in the left gluteus maximus here with the elbow to cause that particular tension for whatever to come back into order. And if the line is in the left sclera, showing that the back will be pulled off to the left, then you go into the gluteus maximus in the right side to pull that over. If you have it in both eyes, you work on both gluteus maximus in the way which we'll be demonstrating again in the body electronics class. So that has to be done. Now, yes, sir, Michael?
The line in the sclera on that slide was almost at right angles to the way the spine is drawn in Jensen's chart. So I'm just wondering if the degeneration line was at indicated in the sclera at roughly right angles to that degeneration line. Does that have any specific indication different to what we've just spoken about?
Yes. Let's say you have an indicating line coming in this way. you take that directly into the spinal area, and that will tell you which vertebrae is going to have special attention, where it's been injured in some way, or you got a slipped disc, or you have an area where there's a spine which is highly calcified. And if you have an indicating line, you might have 3 or 4 indicating lines, and that'll virtually tell you which vertebrae need attention.
Okay, so how is that different to this particular line? Okay, is indicating tightness in the muscles, perhaps a rectus spinae or something running down either side of the spine. So that's what this particular line, or this indicator line at that angle does. And if it's at right angles to this, it's going to indicate specific vertebrae that need attention.
I would say this is the muscle structures of the entire spine.
Right.
I would say that because it's tied in here to blood flow that goes on down, it would show possibly a lack of blood supply into the spine, which would cause this particular problem. But I wouldn't really have an indicator for which vertebrae from this positioning, only if I had a line crossing over, which we would then take straight into the pupil and then find out where it intersects the spine. That's where I would be inclined to look for the damaged vertebrae.
How would you ascertain which particular one it was? You know, like say we have a line at right angles to this one.
With difficulty.
Right. Okay.
You might be able to hit it within 5 vertebrae.
You just have to poke around in there a bit.
Now, after you know which vertebrae, now, for example, let's say we have a 9th, 10th, and 11th and 12th thoracic vertebrae, which go to the kidney adrenal area. Which one of those, by looking at this, I don't think you can tell. But you know the general direction. But let's say that you had, with that, a very bad small intestine area. You could guess pretty good that the 12th thoracic has probably got a big calcification on it, which would affect not only the small intestine area, but also the kidney, also the adrenal.
Okay.
Because all of those nerve fibers from those areas would go to those organs. But it's only an educated guess. Now, another thing that you'll learn is because of anatomical differences, you might have 2 vertebrae on either side of that, which would have fibers going to that particular organ area also. So you might have 5 vertebrae involved with the same particular problem. So it's not just one vertebrae. You might have the 12th thoracic, but it might be 2 vertebrae on either side.
Yeah. Okay.
Okay? And that would hold true for any other organ. Any other question there? That's a good question, Michael. Thank you very much. Any other questions there? Okay, the next one, please. This is 5. Okay? Now, sometimes you have a degeneration line mixed in with another degeneration line. Now, both of these would be red lines, of course, but I'm showing you the blue one as different than the red one, so you don't get them mixed up. Here's another way of looking at this particular thing, Michael. This line comes in like this, and suddenly you have this taking off very close to the iris and then moving back out again. The area where you really have major degeneration will be in this area here that is closest to the iris. So once again, you get your little pointer out on the iris that you're looking at in the picture of it, or in your own mind when you're looking at the individual, and follow that directly in toward the center of the pupil. Okay? And this would be very, very close to the pupil, which could be, for example, it could be a what I call a dent or an indentation in the autonomic nerve wreath where it's dented in toward the pupil. Okay? Or perhaps it could be going all the way into zone 1 and 2 in toward the pupil, and it's reflexed then out to the spine. See what I'm saying? And so if the spine would be directly influenced by that problem way back in zone 1, for example. You might see a little blotch or a bend in the pupillary ruff, which would be that area right around the pupil, which would be representing the central nervous system. Am I making my point clear here? So the same thing is here. You go along here, you come in here, here's the area to be investigated highly. You already know they have a back problem. Now these will tell you where in the back the problem is. Okay? So you take the spot that's closest to the iris, and that is where you have real degeneration taking place. Now, to me, when I look at this particular area, and I have a degeneration line, and you have a little blotch like this coming in, I look for cancer, or what I would call cancer. And oftentimes you'll see your Medusa effect or an asparagus effect, or you might see a big black pigmentation or a big brown bush or something. And these we pay special attention to when we see them in the iris of the eye. Any question there? Please? Next one, honey. Okay, here's the left eye again. Now, please note, this is coming from the indicating line to the what at 3 o'clock? Heart. Then you have it coming down all along through here, down in here, and then you'll notice a big blue shadow right down close to 6 o'clock. And that can vary maybe 30 degrees. Now when this happens, you already know the person has numbness, tingling in the feet. You will know that the person will have possibly from the heart, coming down the aorta, coming down the femoral artery, down into the feet, and you know that this will be depending upon the redness of this line and how ugly red it would be and how big the line would determine the amount of cholesterol, I should say fatty substance buildup in the arteries. And this, oftentimes you have people, they're walking down the street and the first place the pain comes is in their knees and then down the back of the legs and the calf muscles. Now, I would expect that particular symptomology in this case where the legs are always hurting when they exercise because they can't get enough blood supply down to the legs and feet. And therefore there's not enough oxygen into the legs and feet. And therefore they have pain in the legs and feet. With gouty conditions, you'll see this quite often. Now, many people who have what they call the gout, you give them about 40 drops of oxygen in a glass of water of your stabilized oxygen, and in about 30 seconds, I'll time it over and over again on my watch. I'll have Anita go in and get to about 40 drops of oxygen. We'll bring it back out. They gulp it down. In about 30 seconds, the pain is gone in their feet. Why? They have oxygen there again. The muscles are good. Everything else is toned up pretty good. You get the oxygen down there, and the pain goes away. So you don't need gout medicine. You need oxygen to help to solve that problem. So in this case here, you've got your arteries pretty well clogged up. Now you go to the medical doctor. The medical doctor takes the blood sample and says that your cholesterol is normal. You have 2 types of cholesterol, but all the cholesterol is normal. Are you measuring by looking at the eye? Are you looking at what's in the bloodstream? Or are you looking at what is attached to the internal walls of the artery? You're looking at the structure, aren't you? And so in this case, you can have the arteries fully plugged up, and you can see that from the iris of the eye, with a heavy red blood vessel here in the heart for the coronary blood vessel. Okay? You can see it. And then, when you put them on a program a heavy program of flax oil, which emulsifies that cholesterol and funny fats and so on, along with lipase to help you to digest the emulsified cholesterol, along with niacin to open up the capillaries. What happens? The person's out there, they can walk miles and they don't have pain in their legs because their circulation's back. You have unblocked the blockage in the arterial area. If a person has varicose veins, this will oftentimes indicate the varicose veins also, because if the arteries are plugged up, you can rest quite well assured that the venous structure is going to get plugged up also. And so first of all, the arteries get unplugged as you take the flax oil and so on. And as that is used up by the arteries, eventually you're clear all the way out to the capillary level. Then you come back to the venous system and start clearing out all the old body junk that's locked into the veins. And the flax oil will clear those out also. And the varicose veins slowly, over a period of a year or two, go away. And the person's back to where they can stand on their feet all day long. And they don't have varicose veins. They don't have the pain of varicose veins. They don't have the pain of their feet or their legs. They don't have pain because the oxygen level is high in the body. And the oxygen can get to the tissues when the legs are being used and working and walking and so on. And there's no pain. There's no varicose veins. Is that lovely? Okay. Kyle.
You used to mention lecithin.
Turn around here, sir. Now, what's your question?
You used to mention lecithin.
Yes, I did.
Have you found that that's not of a good quality, what's sold? Is that why you're not mentioning it anymore? Or?
No, did I mention lecithin yesterday? And the day before yesterday?
No.
Yes?
In the nutrition you did, not yesterday. So.
And Health and Human Mind we did.
Okay.
What does lecithin do? What's the new findings on it?
Wasn't there.
Okay, lecithin liquefies, along with flax oil, all the junk in the arteries and veins so that they can be removed more quickly by natural means. What we call an oral chelation process. Flax oil, niacin, lipase, plus the full program. The enzymes and the minerals pull out the heavy metals. The flax oil with the lipase pull out the fats. The niacin dilates the vessel so the blood supply can start moving through those areas. The lecithin helps to liquefy it. And it's also used as a brain food where you find problems where you have a blue blotch up in the brain area, which we'll get to a little bit later on. And therefore, the person might need extra lecithin because the brain is composed of a high percentage of lecithin. What more do you want me to say, sir?
That's it.
Thank you. Yes, sir. The granules, I have never found any granules yet that have been processed properly to where with kinesiology they muscle test strong. Liquids grow rancid, but if you get a good fresh supply of the liquid in encapsulations, it's much better than just the liquid in bottles, because the liquid in bottles goes rancid also. Yes, sir.
For what it's worth, I'd just like to tell the class that at John's last seminar here, Maury dowsed me with the dowsing rods and told me I was over 90% blocked in the arteries to the heart. I was put on the table and John looked at me and said, told the class that if this man was in my surgery, I would hold his heart points straight away. That was the heart line coming into the iris.
And touching the iris.
Okay. I then went on the program of the flax oil and the, as he just stated, and I must tell you, I wasn't on a full program. Gloria and I were in America for a couple of months, and if anyone's been to America, particularly on a bus, all you get there is fat and sugar. That's true. All those buses pull up at the takeaway shops, and all you get is fat and sugar. I was on the flax oil, I'd say, once a day, sometimes twice when we pulled in at night, with lecithin and the lipase. John's looked at my eyes and said, you're great. Maury dowsed me the other day and he said you're 45% blocked. What else worth?
Now let's talk about 45% blockage. Now, stay up here, Ian, please. Stay up here, Ian. Now, first of all, what are the symptoms of a blocked artery? Did you ever have pain in your knees when you worked hard?
I used to get off machines at times and get a lot of pain in the knees if I jumped down off a machine.
How about cramping in the calf muscles and pain in the calf muscles?
No.
Did you have pain in the lower part of the leg?
No.
Did you have numbness in your feet?
Not that I can remember.
Okay, Gloria? Come on up here, please. Oftentimes, us men folk, we just blindly go on ahead like a bull in a china shop. You know, we keep on going, and the woman knows what we're going through because she's the one that's doing the massage work and doing all the work to keep the man alive and going. Now, Gloria, tell the group here how it was.
Well, it's like Ian says.
Speak up into the speaker if you
He
can.
does still have a lot of numbness in this area of both legs.
Numbness in both in the thighs?
Yes. And his knees gave him a lot of problems, but now he hasn't complained about his feet, but this area he still has lots of problems here.
Now, if you take old athletes, you know, do they ever complain about their pain? No, they just keep right on trucking. And this is the thing that you find about men who have had a lot of pain in their life. They don't realize how bad they hurt. And they just keep right on going. As long as they can move, everything's just fine. If they have numbness in their legs, everything's just fine. Now, come back here, young lady. I want you to repeat again and show everybody in the class exactly where the numbness was in the legs.
My numbness right now is just down the side of the leg here. And what happens, I get a lot of numbness and then it burns in both legs.
And that's today.
That's today. That's been for a while, yes.
Okay. Now, what muscle structure is right up and down the front of the thigh? Quadriceps. What's in the quadriceps? What's the reflex to what organ is the quadriceps? To the heart. And I have found, by working over many years with people, that if there's numbness in the quadriceps, anywhere in the front of the leg, front or side, which the quadriceps is, you are then having a problem with the heart. You correct the heart, and the numbness goes away in the legs. That's a reflex. You go to the kinesiology books, and the quadriceps are directly related to the heart. If you have a heart attack, what part of the muscles in the legs are affected when you're climbing stairs? The front of the thighs. You can't climb stairs because the quadriceps are weak. You got that? So you look at an individual, you ask them where the numbness is. If they tell you it is in the quadriceps, what do? You know that they have a heart condition at that point of time. Now, are you going to tell a person who has a heart condition that they have a bad heart condition? No. But if they're 90% blocked and they come down to maybe 40% blocked, they're not going to have the symptoms they had when they're 90% blocked. So you tell them, now you just stay right on the program and everything's going to be just fine. And that's what I tell people. And if they stay on the program, I know everything's going to be just fine. And so I don't worry them by telling them, you just keep doing what you're doing. You continue playing your tennis. And everything's going to be just fine. But you know there's a problem there. But why worry a person so much that the worry adds insult to the injury? Now you might say, well, that is downright irresponsible. Do you follow what I'm saying? That's downright irresponsible. But if I see the eye improving, I tell a person, that don't change what you're doing, continue doing right what you're doing, and everything will be all right. Now, that's what I would say. But if there's numbness down the leg here, it could be, if it's on the side of the leg, what muscle structure goes up and down the side of the leg? Fascia lata. That goes into the colon area. But if it's in deep through the quadriceps into the muscle structures of the leg, that's the quadriceps. Now you remember that that's directly related to the heart area. Now if you have numbness in there, that means you have part of the heart that hasn't been fully taken care of, because a lot of activity puts stress on the heart, reflex down in here into the quadriceps here. Yes, sir. Come on up here, Maurice. Ian, stay on the program. Now we'll have the master here telling us what to do.
No.
Please do so,
But,
just as you see it. You did the dowsing.
This has nothing to do so much with him. Can you hear me? I've been a follower of this fellow called Hans Nieper. Have anybody here heard of Hans Nieper? He's a German a cancer specialist for the past 30 or 40 years. And he wrote a book in 1983, which I just got hold of recently. The point I want to make is that I've been reading bits and pieces of this book, and he said that before a person's has his heart attack, that the heart muscle and the associated arteries and so forth are already degenerating. He goes on to say, I want to say this because it's associated with what you're talking about. He said that these areas of circulation use fat for their energy supplies. And he said most muscles, nearly all other muscles, use carbohydrate or sugar for their energy supply. But the heart and the associated circulatory in the arteries and so forth use fat as their energy supply. Now, because of this, when the heart and circulatory organs start to degenerate, they don't have the capacity any longer to use the fat in the blood vessels, the fatty material, the lipid material in the blood vessels. And this is why the lipid material or the fatty material, the cholesterol and all that other stuff piles up in the blood. That is secondary to the fact that the heart and the associated blood vessels are degenerating. You follow me a little bit? The way we learn it, not necessarily through our friend here, but generally, you think, oh, we're having a lot of fatty garbage in the blood vessels, and that's going to lead to the heart attack. But the fatty garbage in the blood vessels, according to Nieper, this is secondary. This is what happens as a result of the degeneration. So the question then comes up, and he didn't answer this, why the degeneration? Which I suspect has to do with several items. The overload of sugar in one's diet, the overload of unnatural fats found in margarine. This is the so-called the trans fats. You've heard of the trans fats. These are polyunsaturated fatty materials which are not found in nature, but they're made in factories, and they get into margarines, and you'll find them. My daughter-in-law brought home some peanut butter, and I said, "Did you look at the label?" She said, "Well, what for? It's peanut butter." I found something called partially hydrogenated oils in the peanut butter. I said, "You see, that partially hydrogenated oils is deadly, absolutely deadly, as is the margarine that your doctor tells you to use for your heart disease. Both of them are deadly." And so between the sugar and the unnatural fats, which gets into cell membranes, and cell membranes surround all cells of the body, so the cells can't function properly as to what gets through, what gets in, what gets out. And so the the cell membranes are degenerate, become degenerate, and what's inside becomes degenerate. And then in the case of heart muscles, and in the case of circulatory organ muscles, because that's what's there, you get degeneration there. They can't utilize the fat that's in the blood ready for them to use, but they can't utilize it, so these fats pile up. And the doctor says, "Oh, we've got to put you on a drug to knock your cholesterol down." But what he needs is a hole in his head, because that won't do you any good. It will do you a lot of harm. And what you need to do is to change your lifestyle so you get away from bad foods and get on to good foods. Did I say enough?
Beautiful. Thank you very much, sir. Okay. Could you all turn, please, to page 2 of your Sclera checklist here? I want to go over a couple things here with you. You've got people coming in to see you in your office. You're checking them out carefully. You look at their eye, and you see a hard-boiled egg white. Would you please look at number 3 on page 2? Here it states, if hard-boiled egg white, and this is what you see, emergency treatment if there are no sclera lines. Immediate ingestion of the electrolytes, which would be the minerals, orally or through the skin, or rectally implanted if they can't swallow, and some people cannot swallow. But rectally implant the minerals, and immediate body electronics is to be administered. And then if few sclera lines are visible, then use the same emergency activity. Now here's where you've got problems. A lot of people have just very faint sclera lines. You make sure that they're nutritionally prepared, and get them immediately on the body electronics, so that the sclera lines begin to come back in the sclera of the eye, showing that there's a little life left in the old bird. This we have to do, or else you're going to lose that person right off the bat. And usually, if people have gone the medical route, and the medical doctors say nothing more can be done for those folks, then you're the last resort. And people are going to come to you, and they're going to expect you to perform, because you're into natural medicine. Okay? And oftentimes, you won't have the time, perhaps. We had one of the ex-members of Parliament up in the Cook Islands, and he was in the hospital on 9 different drugs. He was going downhill rapidly. His heart was giving him trouble, so they couldn't find the heart beating in the wrist. The pulse was gone. What little pulse was very, very irregular. His body was turning ice cold. And the doctor in charge said, there's nothing more we can do. Told the family to call all the family home from Australia and New Zealand, and get ready for a funeral. And they sent him home that evening. Anita and I were called over to the house, because we were not allowed in the hospital to help him in the hospital. We're called over to the house, and he was scarcely breathing. He didn't recognize anybody. His body was ice cold. We couldn't find a heartbeat. He was just on the verge of death. We held the STO point. We held the heart points until we held the heart firing mechanism points, and then the heart started beating. He started breathing a little bit. His body started warming up, and we held the STO point until that was flat. But he didn't recognize anybody. He didn't say one word. He lay there. Was that in the morning? That was in the morning. All the family in the meantime gathered. And because I had been called in to help him as a physician, I was invited to the family gathering. And they asked me what was going on and how I should explain body electronics. And I did. And then the fellow that we did points on, after they were into the family gathering for a couple of hours and talking back and forth and arguing back and forth, he sat up in bed and talked for 40 minutes. He sat cross-legged in bed. He talked for 40 minutes. His mind was just as clear as could be. We checked his heart. His heart was a little bit, irregular, but doing quite well. And he talked for 40 minutes to his family. And he said how he couldn't think, how he could hear people, but he couldn't speak, he couldn't respond. And every time they gave him the drugs, that knocked him out to where he couldn't do anything. But when evidently after we got the nutrients down him and the drugs began to come out of him, he came back. That was about 2 years ago now. And he's still doing fine today. Was it worth it? Yes, it is. Was his sclera white? His hard-boiled egg white? Did I tell anybody that? No. But I knew we were dangerously close to death at that point of time. Now, I don't like to have my soul forced out of my body because I have a sick body. When I go, I want to choose to go. We should have the right to choose the time and place when we depart this physical body. But we haven't fulfilled our mission yet if we have a sick body and it pushes us out of our body before our time. So I think we have a job to do everything we can to help patch up this old corpus delicti and get people to where they can live until they fulfill their measure of creation. And then when they go when they're ready to go. Most of us, frankly, we have a gravestone over our head and we haven't finished what we came here to do. And most of us don't know what we are to do. And so sometimes we have to find that out, and that's through a lot of prayer, a lot of meditation, and find out what in the world are we here for. It might be just to raise a nice family. It might be to become proficient in sports. It might be to where we have to learn how to make this body work. Some of us need to be doctors, and some of us need to be grave diggers, you know. We all have our choices, but we also have our things that we have to do karmically to complete what we have to do to balance up our life continuing on this planet. Anyway, this hard-boiled egg white is very important. And so when we come to that, there's no sclera lines. We'll have that one of the charts in here a little later on. Now, number 4 on page 2, I want to go over that with you. If the heavy red sclera lines are touching the iris, as they were in the case here, case in point, if the heavy red sclera lines are touching the iris in the left sclera in the vicinity of 3 o'clock, and or heavy red sclera lines are touching the iris in the right sclera in the vicinity of 9 o'clock, I call it 9 o'clock-ish, make sure that the sufficient mineral or electrolyte consumption has occurred before the points. Emergency treatment will include one person on the STO and then as many possible on heart points and the heart firing mechanism. Be sure to take the pulse. Know how to take the pulse. If you don't know how to take a pulse, then learn where the pulse is and learn how to find it properly. Sometimes you find it in one wrist but not the other. Sometimes you can't detect it on one side of the neck, you can the other. So this is another thing I want you to consider. Now, if the heavy red sclera lines are nearly touching the iris, the same thing applies. All of you, if you're going to read the eyes and put people on programs, you should absolutely know which points to hold for heart points, for the heart firing mechanism, the STO points, and so on. One of the first things you look at, which is one of the first impending signs of death, we talked about the square autonomic nerve reed. We talked about the black from the pupillary from the zone 7, moving inward from the scurf rim to match the black moving up from the pupillary frill. And when the black comes together, that's a sure sign of impending death. The third is the black diamonds in the autonomic nerve wreath at 3 o'clock, roughly in the autonomic nerve wreath of the left iris, and at 9 o'clock in the right iris in the autonomic nerve wreath. And if those black diamonds are there, this shows that there is going to be a very, very irregular heartbeat. And so if those are there, that should be fixed. Because once again, I have seen people just before death, I've seen them with these big black, what we call the black diamonds in the autonomic nerve wreath in the area I have just designated to you. Now this bothers me a little bit because there are some people that pay no attention to you and they go off and die. For just point holding, one good point holding on the heart firing mechanism, and the fibers move right up through those black diamonds, and then the person's out of danger. Now on the other hand, what I've talked to you about the last 2 days is that as soon as you bring a person up through this danger zone for their heart, and they get feeling back in their body, and they're no longer numb in their body, and the gonads start working, then you've got all of the estrogen spewing out all over through the body, and you have very rapid abnormal tissue growth if you have any indication of cancer in the body. At that time, you must warn the person ahead of time that even though their heart is fixed temporarily, they've still got other problems, and they must have, for their protection, a continual ingestion of the proteolytic enzymes to help to counter any type of abnormal tissue growth. Because the proteolytic enzymes, which would be the papain from the pawpaw, or from the kiwi fruit, which is your actinidin, or the physin from the figs and so on, you get that into the system, and this will eat up the abnormal tissue which is growing from the activity of the estrogens being emanating from the gonad level. The testicles are oftentimes removed when a person has cancer, so they don't have any more of your estrogen spewed out into the system. And so to help to cure a person of cancer, to keep it from growing, you cut out the testicles or remove the ovaries of a woman. This is not a solution, but this is what is done. And when you understand the working of the endocrine system, you understand that's unnecessary and quite brutal, because you cut the testicles out of the man, he can no longer have children. Take the ovaries out of a woman, she can no longer have children. This is a problem. You with me on this? Okay. And this all goes back to the point holding for emergencies. So if you do have an emergency situation and you hold a person's points, it doesn't stop there. I've told you the problems we've had in the past, in the last couple days, on people who get their points held just out of curiosity, and they've got cancer, and about 2 weeks later they're dead with a very rapid, fast-growing cancer. Now, was it the body electronics that caused the cancer? No. It was the body coming alive. When the person goes through the numbness in the body, and they come alive, and the gonads are overactive. This is why you don't hold points on somebody without explaining to them what's happening. Now, in an emergency situation, you can't do a lot of lecturing at that time because the heart's not working. So what are you going to do? Keep them alive and then tell them what they have to do afterwards, okay? But do what you can to get them alive. If a person has been on a junk food diet, chances are very good point holding will not help. Send them to the hospital, get them in the intensive care unit where they can survive, and pick them back up and help them after they come back out of the hospital. Our first responsibility is to help them to live. But the thing is don't try point holding on people who have not been on a good diet in an emergency situation. Let them be taken care of through the proper medical authorities who are trained in emergency medicine. Okay? Is that clear? Okay. You look in the eye, and sometimes you got some terrible things to work with. If they're on a good program, they'll respond beautifully. If they're on a junk food diet, they will not respond at all, because their body is enzyme deficient, mineral deficient, and if a body is mineral deficient or enzyme deficient, it won't work. Now let's go back to enzymes. Why? You cannot absorb minerals and utilize them in the body if you're enzyme deficient. And that's the reason why. You have to have enzymes in the body to utilize the minerals properly, so you have electrolytes in the body. So there's an interrelationship of the nutrients. And that's why we have all the nutrients together to make sure that the body can go through its regenerative process. Yes, sir? That was your question. You're getting pretty good at thinking. Okay, Anita, what do you want to say, please?
I just thought it was interesting that Murray was talking about sugar when Ian has a real sugar thing. And I'm wondering...
He loves his sweets.
I'm wondering if he really heard that.
Now, this is what Anita does to me occasionally. Ian, don't feel like the Lone Ranger, sir. After this, what this little girl's been through in her life, she's turned into a real purist, and I think she's probably correct. But would you like to share with everybody what she had to eat for dessert? We won't embarrass you, Anita. This time. We won't mention that you had that beautiful trifle. We had a lovely time. The desserts were absolutely excellent. I haven't had a chocolate mousse for about 5 years. So we enjoyed that. Did I tell you that I treat myself occasionally, but I never cheat? Does anybody else treat themselves occasionally? Enjoy. Bless it and send us on its way, but enjoy it immensely, and don't get this attitude, oh, I shouldn't have done that. Do it with your eyes open and with enthusiasm and really enjoy it. Now, who was it the other day? Anita, come up here, please. We're going to have a little fun here. Are you ready? What happened the other day when you brought out some of the things that we were muscle testing? We're muscle testing some different products, and I used white sugar as a means of... Now...
Yeah, we were muscle testing a product, and so I was using white sugar as the negative, as the bad thing. And so all of a sudden, John tests the white sugar on me, and my arm goes strong. I go, uh-oh, there's something strange here. And then I said to him, what did you do to this? And he blessed it.
And then what happened when you complained?
I said, take it off, and he did, and then my arm just went weak.
And then what did I do?
You re-blessed it, and it went strong.
Now this is what I want you to learn how to do eventually, where you can take anything which is negative to the body and bless it so thoroughly that your body will thrive on it. And you can also, on the other hand, you can also remove that blessing from that if you want to, and the best food in the world becomes nothing but a terror for you, Because if you take away the good vibes from it, then it will be negative to your body. Now remember, it's not what you put into the body, it's what comes out, your thinking, your feelings, and your emotions. But if you bless your food, that turns into nothing but health-giving to the body.
But you better digest it fast because it'll only hold for about 20 minutes.
Mine hold much longer than 20 minutes. Yes.
Back to the heart.
That's a heart subject.
You get your exercise fanatics who are convinced that they're fit and healthy, and they keep their hearts long before gone numb, and they're still kind of pushing themselves. They don't want to believe there's anything wrong with them, and they don't want to go on a program. And if you leave them alone, they're going to go back out and over-exercise again and have a heart attack, maybe.
How do you know that a person's heart is out of sync with the universe? When it's not 72 beats per minute. And what is happening with a lot of these athletes is they are overstressing themselves to where their heart goes really slow. And I'm one of those that has forced himself into that, and consequently, having been an athlete, I used to push myself to the limit to perform in athletics. And so years ago, I have had an enlarged heart. At the age of 40, I had a heart attack where I was told I'd never be able to work again because of all the heart damage.
Okay, so you get your people like that. Do you tell them that they need to do some work with their chest area, or do you tell them they definitely need to get on a program straight away, and then they want to know why? What do you do?
You are very careful and you educate the person very thoroughly, and 9 times out of 10 they will not believe you, because when they are in pain, what do? They go out and they exercise and push it to the limit until they're out of pain and they feel a high and they feel wonderful. And when they feel wonderful, after exercising really hard, what is actually happening to their body?
They're stressing their heart. Their heart line grows and grows.
And grows, but what's happening to their body?
It's going numb.
Their body goes numb so they don't feel any pain. And so what a lot of these athletes do is as soon as they start feeling a little pain, oh, I've got to go out here and run. I've got to go out and exercise. And the exercise till they don't feel any pain again. And you do a pinch test on them, their body is numb. What happens to the fibers in the eye, Kyle?
They're dark.
The fibers in the eye for most of these athletes that push themselves beyond the point of endurance, the fibers go back into the back part of the eye as the heart line grows and grows and grows.
So during your process of attempting to educate that person, somewhere along the line, they're going to get the distinct impression they're going to need to do some work on their heart. But so you've told them that, but you've educated them also.
Yes.
You don't panic them.
No panic. That you just tell them to keep doing what they're doing, and then start educating them. But if you have a big blue blotch in the heart area, which we'll be getting into a little later in the sclera of the eye, and another big blotch in the thymus area, here's where you have the symbols of the workaholic who goes and goes and goes and goes, including the athletes. And this is where I believe that we can then apply exactly what Maurice had said, because the heart has already reached a point where the muscles are degenerating. And they're no longer muscle fibers, they're fatty substances in there posing as muscles. And you've already reached the point where they're beginning to degenerate. And here's where people have to start taking care of themselves.
Just on that point.
Come on up, sir.
Just on this point that you're on, have you tried to work on people on the numbness and say, okay, well, let's do a pinch test on you? Are you concerned about the pinch test, etc., and sort of work on that angle?
That's part of their education. sometimes they're real stubborn, and it doesn't seem no matter how hard you try, they won't go for it, and then you end up wondering who's responsible.
And then they take a look at the high pain threshold and think the high pain threshold is good. And if you have a low pain threshold, you're a wimp because you can't handle the pain. They're tough guys. They're out here working. They don't know that their heart is hurting them because they can't feel it. I've got people in that boat. They don't know that they're hurting because they don't know they've got pain. You do the STO point, and all of a sudden they have pain blooming out all over their body. They have angina. They have heart pain. They hurt. And you've done it to them. And they're the victim of your type of therapy, and they don't want to have anything to do with you anymore because now when they go out and run, they hurt and have pain, and you did it. See? And no matter how much you educate many of these people, they don't want to listen because they're the tough guy, and they feel invalidated if they can't go out here and run 10 miles a day.
Second question. Is that enough on that one?
Go ahead.
If you have your heart indicating line coming in at 3 o'clock in your left eye, a degeneration line running down into the gonad area, is that close enough to the leg that you say, well, that's poor circulation of the leg, or is that a tie-in with the ovaries? What have you found there?
Both.
Uh-huh. Okay.
Okay. Any questions there? Okay, Steve has just informed me back there and that lunch is ready. Are you having fun yet? Yes. Are things making sense to you? Yes. Okay, real good. Have a good lunch.
Mother first broke his collarbone about 3 years ago. Is that better?
Speak right directly into the...
That way.
Yeah.
Okay. Mother first broke his collarbone about 3 years ago, and then recently, only 2 weeks ago, it was broken for the second time. It had a very large calcification around here.
Speak directly into it.
Okay.
Get close up.
Is that better?
Yep.
Okay. A week ago, David Whistler and I did a point holding, and Mother had a wonderful experience on the table, which he'll be able to describe to you. He did a very, very good job. He went straight into the first time when it was broken, relived the experience, and he was able to intensify it and had a full burn. What I would imagine is a Kundalini burn, which I haven't had myself, but the way he described it, I felt quite sure that was his experience. And straight after the session, he was able to discard his sling and move his arm in different directions. Maybe he'd like to tell you a little bit.
Well, it was kind of exciting, I suppose, having to be able to use the arm. So normally with your arm, when it's a broken collarbone, like limited movement like that, but you move it that. And now I can move it forwards, backwards, and even up. And it's still regarded by the doctors as something weird. You know, they wouldn't have a clue. Like, if that was fully healed, as it nearly is, they'd say, no, that hasn't been broken, you know, what are you talking about? They just wouldn't have a clue. They wouldn't have an explanation. But when I had the Kundalini, it was interesting because it's like you're in the center of a fire. But when you think of hot, you touch a hot plate, you know, ow, it's going to burn you. But it's not like that. It's just wetting, like you're just boiling. And then the air feels like acid on your skin because of the immense heat. And so you just want to, I don't know, go away. But you just sit there and you have to lovingly accept it, which is hard. And, and, you know, when it's finished, you get off the table and it's like, you know, it cools down. But when I was on the table, my left arm, which is the one that was broken, was pinned to the table somehow. and that was the one that David was on, and he was pressing on the calcification, and he was pressing pretty hard, and it felt like the calcification and the bones were melting, and then like molten lava, and then they were settling, and my arm was pinned down so it wouldn't move out of place, so when it settled it was correct in the right position. So if I had have jolted it, my arm bone would have been bent. So that's why, I don't know why, but that's why it was pinned down somehow. And that was quite strange, but obviously for the good. And that's basically it.
And then this morning, Dr. John worked on this, which was a very large calcification for a period of time, and it's now reduced very much so. And Madhava feels that his arm is, since then he can move it right up. Before that he couldn't move it up that high.
I left just a little bit left there. There's just a little tiny bit of calcification, so they can work that out at home, so that nobody will blame me for having done that.
I'd like to make it clear that the bone was broken in the same place twice, so that it was quite a difficult one to get to, and it did need more than the one point holding, as it turned out. But the other thing that I want to say is that often when people are on the table, they start to feel pain and then they want to move their body. And not Malabar, he just lay there. And I actually held two places just on the outside of the break, and I was giving him heaps, as it turned out. And every time I checked in with him, it was hurting like hell, but there was no way he wanted to back off. He was very willing, and he loved, if it was possible to love what was happening, you did it, didn't you? Yeah, so you really showed us how a patient needs to be when they're on the table receiving the energy. Yeah, congratulations.
You've just got to love it, and it's not for the bad of you, so it's like, I might get a treat today, it's worth it. Why not go to town and you might get something. Whereas if you don't remind your mum, she might forget.
Carol, explain to everybody what color his eyes were and what they are now.
Oh, his eyes appear lighter now than previously. They were more brownish, and now they've got a bit more green, little blue around the edge.
Anything else, sir?
Well, the first time it broke, that was quite easy to access because nothing happened. But the second time, the ambulance came and they gave me an anesthetic, so I couldn't find the pain. So we didn't go to the second break, which is sort of a reason why the calcification didn't lower any more at that time. Because the anesthetic was on me, and you can't feel any pain. So I couldn't get that last maybe 10 seconds that I acknowledged of having the pain because I forgot it with the anesthetic. So it's just nearly impossible to access. But it is possible.
Thank you. Thank you very, very much. Did you hear about the anesthetic killing the pain? And when anything which kills the pain stops the person from healing. Because you have to access the pain in order to bring about a healing. Now, if you go back in history, in, we'll call it ancient history, in the good book, they say to stay away from the sorcerers. And if you do a very careful analysis of the origin of the word sorcery, it comes from the same word of the pharmacy or pharmacopoeia. And so technically, when you look into it, the people who were told be sure to stay away from these people, This was the people who were called the druggers, or those people who used drugs to kill pain. Okay? Who are the modern day sorcerers? Now stop and think. Pardon? People who are applying anesthesiology, people who are applying any type of painkillers, people who are using drugs. And where is their temple? The hospital. That's the temple where they practice their rites. If you stop and think about this and study through it, you realize that this is what you are dealing with, because these people do not understand life. They are masters of death when they're dealing with the physical body. They take away the life from the body with the drugs and painkillers which they are using. Please consider that. A lot of people don't like to hear that. That's the way it is, my friends. And if you want to bring life back to the body, you have to get all the anesthetic out of it, all of the drugs that have suppressed symptomology, and all the painkillers that have suppressed pain. And that includes anything which would be considered a painkiller, whether it be marijuana or any other pain-killing drug. Did I make that clear enough? Okay, because as long as you are suppressing the pain with ascorbic acid, vitamin C, or any other thing which suppresses symptoms in the body, any synthetics which would suppress pain, which would come under the auspices of what they call vitamin pills, then these are the things that we want to get rid of and bring ourselves as close to nature as we can. That's a little hard to say, isn't it? But it has to be done. And that has to be said. Yes. If people have steel pins or wire in the body from operations, this is very, very difficult, because you have to work around that, because that creates a vortex of energy in the body which retards healing. Any type of dissimilar metals also in the jawbone, like gold and silver amalgam, creates little mini currents, like a little battery in there, which will upset the meridians of the body and keep the body from healing. Yes?